How did a decades-old anesthetic evolve into one of the most groundbreaking treatments for depression today? Meet Spravato, the FDA-approved nasal spray form of Esketamine, a medication reshaping psychiatric care in unexpected ways. Spravato, the brand name for Esketamine, is not your typical antidepressant. Derived from a medication originally designed for anesthesia and repurposed through decades of research, this fast-acting nasal spray is gaining momentum as an innovative treatment for adults with treatment-resistant depression. As a disclaimer, this video is for educational purposes only, and it does not substitute for professional medical advice. I am not a doctor, and you should always consult with a licensed healthcare provider before making any treatment decisions. As always, our goal with TheClinResearcher is to raise awareness for clinical trials and present information on medication approvals and clinical research studies. How about the origins of Spravato? Esketamine is the S enantiomer of ketamine, which means that it is a molecule with a mirrored twin that interacts differently with the brain. Ketamine was first synthesized in the 1960s, but surprisingly, it was used as a battlefield anesthetic during the Vietnam War. Its associative effects and low risk of respiratory depression made it ideal for trauma care. Now, if we fast forward to the early 2000s, that's when researchers observed that patients undergoing ketamine treatments for pain or anesthesia often reported elevated moods. That's when small trials at institutions like Yale began exploring sub-anesthetic doses of ketamine for rapid antidepressant effects. Recognizing this potential, Janssen Pharmaceuticals created Spravato, which is a nasal spray formulation using esketamine. In 2019, it received FDA approval for treatment-resistant depression, marking a new era in psychiatric medicine. But how exactly does it work? Unlike traditional antidepressants that target serotonin or norepinephrine, it actually targets glutamate, the most abundant neurotransmitter in the brain. Esketamine blocks NMDA receptors, which leads to a burst of glutamate activity and stimulates the growth of new synaptic connections. This action helps rewire the brain's stress and mood circuits, which results in rapid improvement in depressive symptoms, often within hours to days, rather than the weeks required by SSRIs. Think of it like restarting a frozen computer. Spravato doesn't just update the software, it reboots the entire system. Now, how about the clinical evidence? Well, a pivotal 2023 study published in the New England Journal of Medicine compared esketamine nasal spray with extended-release quetiapine in adults with treatment-resistant depression. And here are the key findings. Remission rates. At 8 weeks, 27.1% of patients receiving esketamine achieved remission compared to 17.6% in the quetiapine group. For sustained remission by 32 weeks, remission rates increased to 49% for esketamine and 33% for quetiapine. Adverse events. Serious adverse events occurred in approximately 5% of patients in both groups. However, discontinuation due to side effects was higher with quetiapine at 11% than with esketamine at 4%. These results suggest that esketamine nasal spray in combination with an SSRI or SNRI may offer a more effective treatment option for individuals with treatment-resistant depression. Now, this is very important. Let's talk about the side effects and the safety. Spravato is administered in certified clinics under medical supervision. This isn't a medication you get to take home with you. Patients are monitored for 2 hours post-dose. Some of the common side effects include dissociation, drowsiness, nausea, increased blood pressure, and dizziness. Because of these effects, patients are not allowed to drive or operate machinery until the following day. Now, how about the cost and access? Spravato's cost remains a barrier. Unfortunately, the initial month of treatment can range from $5,000 to $7,000. Ongoing maintenance costs are lower, but they're still significant. Coverage is going to vary. Some insurance providers include it under prior authorization. Medicaid and Medicare coverage is limited and often state dependent. And how about the future of Spravato? Well, research on esketamine and related compounds continues to expand. One area of focus is R-ketamine, the other mirror of ketamine, which may offer similar antidepressant effects with fewer dissociative symptoms. Academic institutions like Yale, Stanford, and Johns Hopkins are exploring new frontiers, including psychedelics like psilocybin and MDMA for mood disorders. Spravato represents the first wave of these innovative therapies entering the clinical mainstream. If we check out the Hopkins Psychedelic Research, it's actually a really cool site, and they claim to be the world's largest psychedelic science research center. So feel free to explore that website. But let's keep going. Who is this medication for? Spravato is indicated for adults with treatment-resistant depression, patients with major depressive disorder, with acute suicidal ideation, or behavior with inpatient monitoring. It is not recommended for individuals with a history of psychosis, uncontrolled hypertension, active substance use disorder, or patients who are pregnant or breastfeeding. Spravato's development reflects decades of scientific curiosity, persistence, and innovation. From battlefield medicine to brain circuit rewiring, its story is one of the most exciting in modern psychiatry. It is not for everyone, but for those who qualify, it offers a fast-acting option where few have existed before. More importantly, it signals a long overdue shift in how we approach mental health treatments. And with that being said, if you guys need any additional help, please visit our website at TheClinResearcher.com. You can find educational guides so that you have a better understanding on what clinical trials are and what you can expect by participating. Of course, make sure you always consult with your doctor or your healthcare provider before deciding whether a clinical trial is right for you. With that being said, if you have any questions at all, please leave me a comment down below and I will make sure to answer it. So make sure you guys get our free ebook that is going to show you exactly what you need to know in order to prepare for your participation in clinical trials. Thank you so much for joining. I hope you enjoyed the video, and I will see you on one of these other videos that YouTube is recommending for you.